Congress has to do more.
New at 6, the very first congressional hearing was held today to address how the elderly have been impacted by the coronavirus. More than 2/3 of coronavirus deaths here in Pennsylvania have been in nursing homes. And this week we got updated numbers for nursing homes in the Pittsburgh area. And with those grim numbers in sharp focus today, the Senate Committee on Aging took up the issue. 11 Investigates' Angie Moreski has been reporting on the problems at nursing homes now for months, and she joins us live in the studio. So Angie, what did they find?
Well, Lisa, many of the red flags families raised in our stories from the beginning are proving to be critical parts of the problem in nursing homes. Pennsylvania Senator Bob Casey is the minority chair on this committee, and he's been a leading voice raising many of these issues.
Senator Casey, I know you're joining us remotely.
In a hearing reflecting the times with senators and witnesses joining remotely, key issues explored which led to the overwhelming number of deaths at nursing homes, from understaffing to lack of testing and personal protective equipment.
The idea that that same nation can't produce enough masks, or gloves or personal protective equipment for everyone that needs it is really an appalling it's an appalling failure.
Coffee filter, folding them in half.
Nursing homes forced to make their own masks.
Why can't my mother be tested for this when she has key signs?
And family members begging to have their loved ones tested. Both issues raised early on in this crisis, but response was slow. Now, experts say focusing just on symptomatic patients was a painful mistake.
By then, it's too late. There is asymptomatic spread, and given the close proximity and the fact that staff go from resident to resident every day, the virus can spread throughout the facility.
Understaffing at facilities, another major problem, as we saw at Brighton Rehab in Beaver County, with more COVID deaths than any other nursing home in the state. Now, a call for pandemic premium pay for frontline workers.
Our nation should reward them as we did returning soldiers from other battlefields in our history.
And this government report just out says persistent lapses in infection prevention and control were issues at more than 80% of nursing homes.
The number of stars has not proven to be a reliable indicator of which nursing homes are safest.
Senator Casey just introduced a new bill calling for $20 billion in funding to do more to help long-term care facilities.
I don't want to be sitting here in December because we didn't do enough on testing, personal protective equipment, and find out that another 4,700 or 5,000 Pennsylvanians have died.
And another critical issue discussed today, providing more funding for home health care so fewer seniors have to go into long-term care during this high-risk time. And for those who have no choice, getting to a point where family members can once again visit their loved ones so they are not alone, especially when they take their last breath. Lisa?